A 37-year-old man presents to the emergency department with rapid onset epigastric pain that started 4 hours ago. He describes the pain as severe, localized to the epigastric region and radiating to the back, and the pain is partially relieved by leaning forward. He admits to binge drinking this evening at a friend's party. He is nauseated but denies vomiting. Vital signs include blood pressure 90 by 60, pulse 110, temperature 37, and respiratory rate 16 per minute. Physical examination shows tenderness on palpation over the epigastric region with no rebound or guarding. The bowel sounds are decreased on auscultation. Laboratory findings are significant for following: leukocyte count 18,000, neutrophils 81%, serum amylase 416, serum lipase 520. Which of the following would be most helpful in determining the prognosis in this case? Now, here in this question, you will see the classic sort of acute pancreatitis presentation, right? Rapid onset epigastric pain 4 hours ago, which is very acute. Pain is severe, this is important, and radiating to the back. If this is given and there is a history of alcohol consumption, you should go towards acute pancreatitis. Doesn't matter, see, binge drinking. Okay? And these are some of the scores used to evaluate acute pancreatitis. I don't think you need to remember all of these scores, the values and everything is tedious. You won't be asked to evaluate on the basis of a single score. It is too much memorization. I'm not even going to go into the details of each score because it's just rote learning. There's nothing to explain. Just try to understand that these are some of the scores that we use in order to determine the prognosis of acute pancreatitis based on various values. You can determine whether it is a mild or a severe pancreatitis or whether it is good prognosis or poor prognosis. There are a lot of these different type of scores in use. So I agree, this is a kind of question which you can answer only if you are aware of various scores and scales. It's not something you can sort of reach logically, you can conclude logically. Now I'll just tell you why this is the correct answer. See, the correct answer is A. This is the only score which you can use immediately as soon as the patient has been admitted. All the rest, that is Glasgow score, CRP score, Apache 2 score, and Renson's criteria, these all scores will be more effective after 48 hours of admission. They hold their value after 48 hours of diagnosis of acute pancreatitis. Right? They don't have as good a prognostic value if done immediately. Apache score is a score which can be used immediately to determine the prognosis. But the only thing about this score is it is very lengthy. It has a lot of values. There are a lot of factors which we do not order labs for. We don't determine those factors in our regular routine labs. And it is very complicated and you will have to calculate the score also. So that's why Apache 2 is also not that useful. That's why the bicep score is easy to calculate, easily determined, and it has immediate prognostic value. You don't have to wait for 48 hours to determine the prognosis, right? That's why it is a bit learning. It is a mugging up sort of question. If you can see here, the criteria of bicep score include all of this. We don't recommend memorizing each and every, but you should have a general idea about what all is used. This is Ranson's criteria. We're not going to discuss, we're not going to go into details of this. There's nothing to understand here. This is Glasgow scale. And Apache score, as you can see, involves 12 parameters. It is very complicated calculation, right? That's why the correct answer is bicep score. And I agree, if you don't know this, you wouldn't have been able to reach the answer by just eliminating and all of that. Okay.
Thanks for watching. Please give a thumbs up and subscribe for more.